Welcome to Jose R. Reyes Memorial Medical Center, Neonatal Intensive Care Unit, also known as NICU. NICU. It is located on the second floor of the main building, besides the delivery room. What is Neonatal Intensive Care Unit? A neonatal intensive care unit, also known as intensive care nursery, is a unit specializing in the care of ill or premature newborn infants. Neonatal refers to the first 28 days of life. Healthcare providers assigned in this unit have undergone special training, and this unit also provides the necessary equipment to give its patients the best possible care. The NICU promotes exclusive breastfeeding to all of its babies and complies with the EO 51, or also known as the Philippine Milk Code of 1986. Now, let's talk about the areas inside the NICU. Step-down area. This area are for those patients that have no contractions except an orogastric tube or OGT. Neomedical area. Patients with complications upon birth needing medical management. Neosurgical area. For those neonates that have undergone surgical operation. Isolation area. To prevent cross-contamination with other non-infectious cases or those needing reverse isolation. Number 5. Breastfeeding room, a place where the mother can do breastfeeding or kangaroo care for her baby. Hearing screening room, where the hearing test is done. Room temperature of 22 to 26 degrees Celsius is monitored every 8 hours to prevent overheating or hypothermia of the babies. Express breast milk or pasteurized milk are safely kept inside the freezer, maintained at a negative 15 to 25 degrees Celsius, and is also monitored every shift. The NICU is capable of carrying a total of 30 infants. NICU modified its areas in accordance with the IATF guidelines on social distancing and proper PPE, furthermore, limiting the total capacity of the unit from 30 to 15 patients. The breastfeeding room was converted to a COVID-19 isolation room in order to accommodate 2 COVID-19 suspects. The regular isolation room was also converted to a step-down isolation for those babies who are negative for COVID-19. Now, let's talk about services offered inside the NICU. Admissions may come from the delivery room by giving birth via normal spontaneous delivery, from the main operating room if the baby was delivered via cesarean section, from the emergency service complex if the baby was delivered within the institution or inside the emergency room. Radiant warmer is a body warming device to provide heat to the body. The patient can be placed to a bassinet. An incubator is also available to use and is designed to provide a safe, controlled space for the infant to live while their vital organs develop. A mechanical ventilator and a cardiac monitor can also be provided if the patient needs further oxygen support and closely monitored. A transport isolate is like a portable incubator. This is used to transport the infant to a radiology department or heart station to conduct any diagnostic imaging or procedure. Phototherapy is used to treat newborn jaundice by lowering the bilirubin levels in the baby's body through a process called photooxidation. Express breast milk or pasteurized milk is given to the newborn babies via cup or tube feeding. Newborn screening is done after 24 hours of life. This is done in order to find babies who have certain serious medical conditions. Therefore, treatment can be started immediately. Hearing screening is done in order to detect problems as early as possible. The physician or nurse is required to don a full PPE upon entering the COVID isolation room. All care management are still provided and rendered to the patients. After the physician or nurse is done with his task, he or she can now exit the isolation room and properly doff his or her PPE. Afterwards, take a shower and change her scrub suit. The praise committee gave the NICU an on-the-spot recognition award for meeting the challenges of the COVID-19 pandemic. These are the services rendered inside the NICU. Thank you for watching. Always remember, we give the utmost care for your babies.